colleagues, on World AIDS Day, December 1, we reflect on our progress in the HIV response and we reaffirm our commitment to ending AIDS as a public health threat by 2030. The UNAIDS message this year is clear. To end AIDS, we must take the rights path. Protecting the human rights of everyone living with HIV or at risk of HIV is crucial for public health. Armenia has made significant progress since the beginning of the epidemic. The National AIDS Program has adopted evidence-based approaches, expanded access to prevention, treatment, and care services. Armenia, for instance, was recognized as a country that successfully eliminated mother-to-child HIV transmission. Not an easy thing to do, so we congratulate Armenia for these efforts. But today, over 76% of people living with HIV are aware of their status and 77% are on treatment. This is great. However, Armenia's progress toward ending AIDS as a public health threat remains fragile. We need a renewed focus on human rights, on gender equality, and community-led responses to accelerate progress. Gender inequality continues to be a barrier, especially for women living with HIV. Many face violence, which leads to lower treatment access, lower adherence, and worse health outcomes for them and their families. In rural areas with limited healthcare access, women are particularly vulnerable. We must invest in gender-sensitive HIV programs, raise awareness of women's rights, and ensure access to legal support for women facing violence. Lack of comprehensive education about sexual and reproductive health puts young people, particularly young girls, at risk of HIV. By investing in education and providing sexual health information, Armenia can help young people make informed decisions and protect themselves. Key populations such as people who inject drugs, sex workers, men who have sex with men, and transgender people remain disproportionately affected by HIV. The legal barriers and stigma push these communities away from health services and hide, and it fuels transmission. We must decriminalize HIV-related behaviours, fight stigma, and support the community-led initiatives. Civil society organisations play a crucial role in reaching these groups and must be supported. The UNAIDS message is clear. To end AIDS, we must take the rights path. This means removing the legal barriers, prioritising vulnerable groups, and investing in community-led responses. This will take us to ending AIDS as a public health threat. The voices of people living with HIV must guide policies that affect their health and their rights. Armenia has the ability, it has the tools, the knowledge, and the communities ready to help end the epidemic. By protecting health and upholding everyone's rights, we can ensure no one is left behind in our journey to end AIDS by 2030. Together, we can make an AIDS-free future a reality for Armenia and for the world. Thank you.